Hi everyone, welcome to our last class of Module 6 and technically the last class for this course, although we have a review session on Wednesday, but as far as the content is concerned, we will be finishing today after spring's break. So I am planning to talk about tobacco. We have already talked about tobacco in our class last Monday. Few people were there. And I just want to go over some of the stuff which I have talked about in that class because I feel it's pretty important from our exam perspective. And this exam, the final exam, is also more important than the previous ones because it carries around 14 points in total as compared to 10. So every question has more points at stake. So I just want to go over the stuff slowly and try to entrench these concepts deep into everyone's head. So, keeping in mind the learning objectives of this whole module, we have already finished and talked about different kind of addictive behavior, addiction. We have talked about a lot about actually the psychoactive drugs, their mechanism of actions. Then in a couple of classes we talked about alcohol in a lot of detail, and last Monday we started discussing about tobacco, its distribution as far as the epidemiology of tobacco is concerned here in the United States. And then we have talked that how tobacco affects our different systems inside our body. And I want to continue with the summary of those effects of tobacco, specifically nicotine, on different physiological systems of our body. And then we will discuss some of the different forms in which tobacco or nicotine is consumed. And then we will discuss some of the potential strategies to quit tobacco smoking. All right, let's start with our health impact of tobacco use lecture today. So, this is a picture from your book, and it talks about different systems on which tobacco has an effect. So, I want to go over them slowly, although I've highlighted a few things, but there's a lot more to talk about them, which is not given in the textbook. So, first things first, the moment we take a puff of tobacco smoke in the form of a cigarette, the first thing which is going to be affected is our brain. The smoke goes straight into our brain in less than 10 seconds. Some books say 7 seconds even, and it triggers the reward center. It's the same reward center which we have been talking about before, the nucleus accumbens. It is the same center on which all the psychoactive drugs, alcohol acts, and it secretes our big neurotransmitter dopamine. Although there are secretions of some amount of serotonin, some endorphins are secreted, but overall, within 10 seconds, once we take a few puffs of cigarette, we have a kind of a feeling of euphoria. And that is because of its direct action on nucleus accumbens or the reward center of our brain. Now let's talk in a lot of detail what is going to happen in our lungs. But before moving on specifically to the alveoli or the lower part of the lungs, let's see what's going to happen on the respiratory mucosa. There are two things which I want to highlight. There are certain hair-like projections in our respiratory tract. They are known as cilia. And these cilia, they just catch all kind of foreign particles, dust, smoke whenever it moves from our nose inside our body. In case we smoke specifically nicotine damages these cilia. And once these cilia gets damaged slowly instead of the smoke getting caught in those cilia. It straight moves into our lungs and have all its harmful effects. The second problem is about increased mucus production. We have some mucus producing cells in our respiratory mucosa, which are known as goblet cells. And these cells are kind of inflammatory cells. And once they sense a foreign object, whether it's the smoke or dust, it just produces more and more mucus. And because mucus is produced, it narrows the airway, it increases inflammatory substances such as cytokines. So, as a whole, it affects the passage of air inside the lungs. So, if we just look at lungs from a passage point perspective, cilia are damaged and there is increased mucus production by the goblet cells. Both have decreased air and then subsequently oxygen intake into our body. Let's move on to stomach. It's very simple. The more we smoke, smoke is an irritant. It goes inside our stomach. It irritates the gastric mucosa, increases acid production in the stomach, which causes heartburn, kind of central chest pain. And if the acid production is more and on a continuous basis, it results into formation of ulcers. So ulcer formation is common in smokers. It has its effect on liver because it converts glycogen to glucose, and nicotine also decreases urine production. And I just highlighted in our class on Monday that please remember alcohol is a diuretic, so it increases urine output. On the contrary, kid I mean cigarette smoke is a kind of a inhibitor of urine formation. We don't want to talk much about nose. However, the olfactory mucosa through which we smell gets damaged with continuous smoke. And as far as our mouth and teeth are concerned, teeth will get stained and oral mucosa also gets affected and have some kind of precancerous changes um, if we smoke for a longer period of time. We want to talk about the heart and the blood vessels for sure. I want everyone to remember two things. Heart is affected because smoking, as nicotine being an active ingredient or component of smoke, cigarette smoke, it increases and stimulates our sympathetic nervous system, which increases our blood pressure, it increases our heart rate. It also makes our blood vessels more prone to plaque formation. Once we have plaque formation, it results into atherosclerosis. There will be decreased blood supply to the heart. Heart has to pump more, and it may land into failure. So, increased blood pressure, increased heart rate, plaque formation, in combination with each other, has their effects on cardiovascular system. The last thing I want to talk about this slide is that reproductive health is also affected quite a lot with cigarette smoke. For example, both in males and females, it reduces fertility. It also causes impotence both in males and females. It's also responsible for ED or erectile dysfunction. So it's always contraindicated in pregnancy or if you are trying to be pregnant because smoke and nicotine which is present in the smoke just crosses the placenta and it affects and harms the fetus as far as growth is concerned, development is concerned, and all kind of um, growth of fetal organs are concerned. So it affects fetus in a lot of different ways. So in general, lot of systems are affected by smoke. We have talked about it in more detail in our class, but I just want to give everybody kind of a revision that how smokes affect different physiological systems of our body. All right, after discussing its effect on different organs of the body, let's try to discuss what are the different and specifically other forms in which tobacco is smoked. And one of the interesting things is about smokeless tobacco. So basically, it's a form which we take in our mouth and either chew it or just keep it in order to get dissolved, mixed with the saliva, and we just ingest it. Sometimes this has lot of bad implications in our mouth. The biggest problem with this smokeless tobacco is it is an irritant. It irritates our oral mucosa. If it irritates our oral mucosa, it's very likely to have cancerous changes. You have a white patch in our mouth, which is leukoplakia. And leukoplakia is a precancerous condition. It changes into oral cancer, the squamous cell carcinoma, pretty quickly. So whether it's the oral mucosa around the cheek, the tongue, somewhere around the lips, or deep inside the pharynx, everywhere irritation of tobacco may result into cancer. So smokeless tobacco is more harmful for the health of our mouth as a whole. Okay, let's talk about this diagram which says as hookah. Just a second, I'll just want to get a good pointer to highlight this. All right, so this is a kind of a way to smoke tobacco which is very common in Middle East and nowadays in the United States. Many athletes prefer to use hookah. Just try to avoid direct smoke. So basically you have a lot of water dissolved here. So instead of smoke coming directly, it passes through water, and and it's a kind of a notion that it reduces the harmful effects of tobacco. However, there are no researches as of now which proves that this is less harmful. All these forms, whether it's the chewing tobacco or whether the smoke passes through water, it always carry most, if not all, but most of the carcinogens and have its effect on different systems more or less same as of smoking a normal cigarette. All right. These are a variety of cigarettes, cigars present here, and I didn't have a picture of kind of an e-cigarette, but the idea here is that we don't want to smoke directly. So a lot of variants of cigarette have been devised by these tobacco companies to allure and glamorize its customers. And with all public health and health promotion schemes coming up every day by different federal agencies, the companies are spending a lot more money and trying to allure their customers to consume their cigarettes, keeping in mind some of the scientific implications which these customers have with these health promotion campaigns. However, if you have light cigarettes which have these big filters, the idea is that it filters a lot of harmful chemicals. But people, once they smoke these light cigarettes, they tend to inhale more deeply, take more puffs, take those puffs more with more force. So overall, they try to extract as much as nicotine as possible. So overall, it have more or less, as I've said with the hookah, similar implications as of normal tobacco smoke. So the overall take home message from this slide is that no matter whether you smoke in the form of chewable tobacco or in the form of hookah or in the form of light cigarettes, e-cigarettes, smoking in any form, smoking tobacco in any form is harmful. All right, after discussing smoking as an individual, let's talk about the environmental tobacco smoke or the second hand smoke. Before we see some of the stats, let me take it, let me point out very clearly that it's a common notion that secondhand or environmental smoke is not as harmful as the first hand smoke if you are smoking yourself. But guys, trust me, this is just a myth. Second hand smoke or environmental smoke is responsible for a lot of catastrophic events, and you can see the stats that it's responsible for 70,000 deaths every year, with 62,000 happening from heart disease, 3,000 from lung cancer, and SIDS, which is sudden infant distress syndrome. So it's a syndrome which is very commonly seen in infants up till 1 year of age, and sometimes they say that if the children sleep in a supine position, then sometimes, they just get distressed, the lungs can't open. They always have small alveoli, so they need a lot of resistance to get opened. So, in short, some people consider, and some of the researchers showed that environmental tobacco smoke is responsible for SIDS. However, deaths from heart disease are pretty much established. So you have a lot of deaths because of secondhand smoke. Apart from that, you can have bronchitis, which is the inflammation of the bronchi. You have pneumonia, which is the inflammation of lung. And if you are pregnant and you are smoking either before pregnancy, throughout the period of pregnancy, especially throughout the pregnancy, there are huge chances that the baby which is born is of low weight because smoke, as I've said earlier, it crosses the placental barrier, it crosses the placenta, it reaches the developing fetus, and have effects on both the growth and proliferation of cells of the fetus. So they are born with low weight and have all other issues related to fetal development. All right. So the issue is that we have so far understood that there are a lot of ways through which we can consume tobacco, and those things have harmful effects on a variety of systems of our body. So what we have to do? So we have to quit smoking. It's as simple as that. But the problem is, it's not as simple as it looks. If it would have been that easy, everybody would have quit smoking and everyone is healthy, which is definitely not the case. So, quitting smoking is definitely hard, it's difficult, maybe not as difficult as quitting um, illicit drugs, but it is definitely harmful. I mean, difficult because it is, there is dependence, and once dependence, especially the physical dependence, creeps in about any substance, it's always hard to quit. Let's talk about some of the strategies to quit smoking. Um, I always feel that it's a good idea to make people aware who are planning to quit that once they quit smoking, how their body gets detoxed. And this is a really good diagram, and I'll go over it slowly. It makes you understand that if you quit smoking, how your body gets into a good shape from a few minutes to a long time, that is 15 years. This is a really interesting story. The first thing which is going to happen if you stop smoking, that your blood pressure and heart rate returns to normal, because once you stop smoking, there is no activation of sympathetic nervous system, and your body have more parasympathetic activity, and your blood pressure and heart rate comes down. The second effect is after 8 hours to 2 days. So in a couple of days you feel that your carbon monoxide level comes back to normal. If we I guess we haven't talked about carbon monoxide as of now. Basically, cigarette smoke has a gas which is carbon monoxide, or CO. Now, if we have oxygen in our blood, it is carried by hemoglobin normally to the tissues where it is used. Now, carbon monoxide has way more affinity for hemoglobin as compared to oxygen. So once we smoke, carbon monoxide replaces oxygen from hemoglobin, and it gets attached to hemoglobin, and this way there will be no oxygen available for the tissues, because the protein, hemoglobin, the protein which carries oxygen to the tissues, has been occupied by this harmful gas, carbon monoxide. So once we stop smoking, slowly these carbon monoxide molecules, their concentration goes down, and oxygen starts to replace them slowly. And in a couple of days' time, in approximately 48 hours, you have more oxygen attached with hemoglobin, and your tissues will be perfused more as they've been perfused before you start smoking. All right. In 3 months' time, your circulation improves and you'll start see your teeth whiten up. So basically, the effect on the blood vessels goes off, and a generalized vasoconstriction which was taking place because of sympathetic activation, it just gets reversed, and the teeth stain will be removed. So you can see some more blood reaching your tissues in a few months' time. Now, 9 months are a big milestone, because we have talked about the function of cilia and how smoke damages cilia, which allows a lot of foreign particles and smoke and aerosols to reach our lungs directly without getting stopped in the middle. So this function, which has been hampered by smoking, once you quit smoking, in 9 months' time, the cilia regenerates themselves, get their function back, and they started slowly catching all those foreign particles from reaching the lungs, protecting our lungs, making them more and more healthy. Now, this is also a big milestone. In 1 year time, or after 12 months, your risk of heart disease becomes half that of a smoker. So you have that humongous risk of heart disease if you are smoking. If you quit smoking, then after 1 year, it comes back to half. Okay, it took 5 years. 5 years are big, guys. It took 5 years to get to reduce the risk of all these cancers, the mouth, the throat, the esophagus, and the bladder cancer to get half. So that is why smoking is so harmful. It took 5 big years to get the risk only to half. You still have more risk than non smokers. Now, I'm sorry. In 10 years' time, the risk of lung cancer becomes half. So that's so many years. And it took almost 15 years. It took 15 years for the risk of the heart disease to get back to normal. So this is so tricky and complicated. It took 15 years to completely get our body detoxed, and your heart's health will become equal to that of a non-smoker. So I thought that these milestones are important to understand, and once you are either devising or telling someone to quit smoking, if you make him or her understand about these milestones, it definitely helps in motivating the person to quit smoking. All right. Now, what are the different ways? You might have been reading online, reading in a lot of media and newspapers. One of the things which is getting really popular is nicotine replacement therapy. So the idea is that it's too hard to just live without nicotine. So if we provide nicotine in some alternative modes, it will definitely help. For example, you can have these nicotine chewing gums. So the idea here is that you are getting some very small of nicotine into your system, so it goes there and have its effect, which is somewhat similar to nicotine, so you don't have that strong craving to smoke. However, because of its low concentration, the harmful effects are minimal. You can have these lozenges, you can have these skin patches. So if you're taking lozenges, just make sure that you are not chewing them. They just be there in your mouth, and the saliva will slowly dissolve it, so that you will get very less amount of nicotine, which is definitely enough to go into the brain and reduce the craving, but the amount is not much that it will have its harmful effects. So in this way, you can just uh, taper the dose and slowly get rid of the whole nicotine urge. Of course, there are some medications. This one, bupropion, is very popular, and many people takes it. So it has its action on the nicotinic receptors, the acetylcholine receptors. So it goes there, it binds there, and it somewhat um, causes secretion of dopamine and endorphin. So if you take this drug, you feel somewhat euphoric, and it serves the purpose by which um, you take uh, you smoke cigarettes for. Um, Also, I was reading somewhere and it says that if you smoke cigarette after taking this drug, because it has already blocked the nicotine receptors, so you don't feel like smoking, and a time comes slowly when you just stop smoking. So these are some of the therapies and medications which have been used really on a large scale for people who plan to quit smoking. These are some of the other tips. I just got this picture from internet. So the idea is that all these activities which can deviate your mind from smoking can help. You can drink water, you can have something in your mouth so that you don't feel like smoking, you are chewing something. Use some kind of mouth fresheners or some kind of chewing gums. Do some medication, try to deviate your mind by doing some kind of hobby, some work which you like to do. I mean, the whole idea is that your brain won't start thinking about smoking. And I just want to tell you that you don't have to adapt a single strategy. It always work in combinations. So once you start to think of quits of you know stop smoking, you can just opt for different drugs, use all the other things, and then slightly reduce the therapies and the drugs, and make all these non medicated hobbies more. So increase their proportion in your stop smoking program, and a time will definitely come when you will completely become a non smoker. So that's the end of our presentation. And I'm sure you have a lot of questions because we are not having this class face to face. So feel free to email me throughout this throughout this Thanksgiving break or before your exam, and I will upload a video of exam review very soon, and there I will just go over all the contents which we have been discussed so far in this module, and try to summarize everything in 45 to 50 minutes, so that that video will become some sort of cornerstone for your exam preparation. Thank you very much for watching, and I'll be more than happy to answer any of your queries on email. Thank you very much.